So we just saw the one-size-fits-all approach to exercise may not get us where we want to be to help us maintain a healthy lifestyle. So here to make it more specific and personal is health and fitness specialist Tyler Hackney with Health Sagewell Health and Fitness. We're glad that you are here. Let's talk about exercise being so important, especially for long-term health.
So here at Sagewell, you hear a lot of us say movement is medicine or simply motion is the lotion. Sometimes just staying moving, staying active benefits not only our external body, but our internal body, our mental well-being, stress reliever, and sometimes people use it as a hobby.
All right, so there's risks, of course, of not being active.
Yep, living that more sedentary lifestyle, you're at risk for more disease, more maybe overweight, just more of those heart conditions.
All right, so we just saw the story of our Guilford County woman there. And there may be people at home who are thinking the same thing. You know, it's been years since I worked out. It's too late for me to get started. She was 67 when she started.
Yep, it's never too late to get started. Sometimes your reason for getting started, you don't hit it till now. You don't hit it until you become a grandparent, a parent, maybe an aunt. Sometimes people hit that reason to get started earlier in life. Like I said, it's never too late to get started. Exercise will benefit you if you're 2 years old, if you're 92 years old.
All right, so let's talk about this. There's a lot of people who have to manage a chronic condition, pain, maybe something of that nature. Maybe they're worried that exercise could actually make things worse. So what do you say to that?
So it's all about finding what works best for your body. Here at Sagewell, we're here to help you benefit yourself, not cause you any pain. So for example, we'll take like a knee replacement. Obviously, we're not going to try to put that knee in any sorts of pain, or let's say you have a heart rate condition. We don't want to get that heart rate above the doctor's prescription. So we find what works best for you and help you reach your goals doing the exercise that you're allowed to do.
Right, so it's not like some people think, well, if I can't just go all out and just like run a couple of miles, then it's not worth it. And that's exactly what you're saying, that it is all worth it, even if you're doing it step by step.
Yep, you can walk 5 laps, you can walk 55 laps. Movement is medicine. All that kind of exercise is going to benefit you in some way, shape, or form.
All right, what's the difference between these two terms? Because sometimes we hear them a lot, and I don't think that they're interchangeable. Fitness and medical fitness. How would someone benefit from medical fitness, and what's the difference?
So here at Sagewell, we are a medical fitness facility. All of our fitness staff have 4-year degrees or more. We're all CPR certified. We're all educated on all of the chronic conditions people come in with and just ready to tackle those goals. However we come in, meet you where you are. We're also backed by everybody in the med center. So our cancer doctors, our heart doctors, pulmonary doctors, and we also have the ER downstairs. So if anything should happen, we're supported by all of the the med center, as well as outside of here. So all the providers in Cone know about us. They refer us to their patients whenever they're graduated with their treatments.
So it's not just like generic overall fitness. It is fitness specifically for whatever it is that you are dealing with in life.
Yes, ma'am. Whatever you are going through, we are ready to tackle it with full steam ahead, keeping you safe, keeping you active, ready to take on those goals.